panelists, please type them into the Q&A box because right now we're going to begin. Welcome back our speakers, and we're going to add 2 more panelists to our panel discussion today. I'd like to introduce the first gal is Ivy Egbo. Ivy is a Cardiovascular Program Coordinator with Division of Chronic Disease, Primary Care, and Rural Health at the Indiana State Department of Health, or I should say Indiana Department of Health, IDOH. In her role, Ivy works with health systems and clinicians on the management, prevention of hypertension and high cholesterol. Prior to joining IDOH, Ivy was a practicing acute care nurse at Columbus Regional Hospital. And then we have Kat Ortiz. Kat is a diabetes program director for the Indiana Department of Health and has been a part of the team for almost 2 years now. Although she graduated from Indiana University with a master's of public health degree, her roots are with Purdue, boiler up, where she received her bachelor's degree in public health in 2017. In addition, she's a certified health education specialist, and Kat has firsthand experience with diabetes as she was diagnosed with type 1 diabetes over 22 years ago, obviously giving her ability to bring this to a patient's perspective to the table as well. So with that being said, our first question today, and what type of partnership or collaboration does the cardiovascular health and diabetes section have with the health systems? I don't know if any of our panelists want to take a stab at that.
Patty, could you repeat the question again?
Sure, I'm sorry. What type of partnership or collaboration does the cardiovascular health and diabetes section have with the health systems?
Ivy, do you want to go ahead and take that?
I can take that. Thank you, Patty. Yes, so we have several collaborations with health systems in Indiana, but I would like to talk about what myself and my teammates will work on. Currently, we have a 5-year cooperative agreement with CDC, and the goal is to improve diabetes, hypertension, and high cholesterol in Indiana. So we currently have a quality improvement project. We call it the 1815 Health Systems Project. And with this project, we work with primary care clinics on improving the health outcomes of patients with hypertension, cholesterol, and diabetes. So some of the things we do with our partners involve working on quality improvement measures, team-based care, refers to evidence-based programs. We also provide access to educational support, subject matter experts. We have a couple of trainings, and of course, we provide community resources and tools. And in addition to that, we bring together our recommendations on best practices out there, and we encourage and foster peer-to-peer sharings among our partners in Indiana.
Awesome. Thanks, Ivy. Sounds like a wonderful project, the 1815 project. Our next question today is going to be directed at Phil. Phil, can you tell us what is the American Heart Association doing to help save lives during, or to deal with rather, with COVID-19 at this time?
Thank you very much. Yeah, AHA is really working across the country and globally to address COVID-19. We know that 40% of people with hospitalized with COVID-19 had a cardiovascular or cerebrovascular disease. So that's something that we're knowing that's affecting our communities. We know, I think we take a look at this in 3 different buckets. We know that people with heart disease and diabetes are more at risk. What was odd was, especially in Metro Chicago, but throughout the country, we were noticing people were not going to the hospital for heart attacks and strokes. And obviously, we couldn't see a decrease that quickly. So that was really concerning. We know people have limited access to healthy food options, supplies, people aren't getting their prescriptions. So that's one area where we're really worried about. We're also worried about individuals who are staying at home. So you stay at home, some people have a high stress eating, they're eating more unhealthy meals, but not being physically active. And then we also know that there's burdens for individuals with the greatest needs. There may be furloughs, layoffs, may not have the savings to fall back on. Some people may not be able to rely on the free meals that they're able to get for their children. So with all of that, we know that moving forward, there is the potential for future problems. We'll probably be seeing higher blood pressure rates, increasing in obesity, stroke, heart diabetes, heart disease rates, and then we may also have a fewer healthier years moving forward. So what AHA is really focusing on is trying to get our hands together and help out in a lot of different fashions. Through research, we're invested $2.5 million into cardiovascular implications of coronavirus. We're trying to work with our science relationships. We have 12 scientific journals, so we're making sure that COVID-19 information is shared within all of those opportunities. We're working with our healthcare professionals. We have a Get With The Guidelines opportunities to create a COVID-19 data registry to better manage patients. So we're working with that, and I think anybody who's currently involved with Get With The Guidelines are able to work with that as well. When we take a look at CPR, AHA is the leader in CPR. We're establishing interim guidance for those who provide CPR training. We're extending CPR certification cards another 60 days to kind of extend that, so people may be able to extend it if their cards run out. We're able to do hands-only CPR through social media. You heard me talk about advocacy as well, so we're working with governors and state legislators to remove testing barriers. And then obviously we're also always focusing with the individuals with the greatest need. So we're working with partners to nourish families, support physical activities, and reduce the chronic burden disease. So a lot of opportunities for us to really kind of focus on. We continue to work on schools, communities, and patients as well. We want to make sure that the mental health portion of this is addressed. We might not be able to do this, but we have to be able to pull our partners together to address the mental health and behavioral health issues that are affecting folks.
You know, Patty, I'll say something real quick. You know, Mona had mentioned in her presentation, one of the biggest drawbacks of our healthcare system today is the siloed healthcare system. We tend to practice in silos where you have general practitioners, you have endocrinologists, cardiologists, neurologists, nephrologists, and everyone does their own little thing. And there's gaps in between each one of those subspecialties. And I think Phil put on his slide, you need a cardiac champion. You need somebody who's going to take control of the situation and make sure there's continuity between all the different silos. And that's a problem because no one wants to do that because it's hard work. You don't get paid to do it, and it takes a lot of time. And so that's why you need the support of your healthcare system if you're going to do this. Where I was able to go to Ascension Health and say, this needs to be done. You know, we need to form a cardiometabolic center where we put threads between all these different silos and pull it together. Otherwise, we're never going to get anywhere because somebody thinks somebody else is going to start that drug. They're not going to do it. Somebody else is going to do it. And the next person thinks somebody else is going to do it. And it never gets done. And that's the problem. So I just want to thank Mona for bringing that up in her slide presentation because that is a real issue.
Thank you.
Yes, and I know, great comments, Doctor. Phil, you mentioned about a COVID registry. Could you, is this American Heart Association has a COVID registry that's available to practices?
Yeah, you know, I mentioned in the target, in the No Diabetes by Heart, target type 2 diabetes slides that there were Get With The Guidelines stroke, Get With The Guidelines heart failure. There's a couple other ones as well. I think the first place I would take a look at is if your health system is involved with Get With The Guidelines, there should be an AHA representative that they can reach out to and utilize that registry. So that would be the first place and opportunity. But I think contacting your local AHA office and they'll walk you through the process to take a look at that COVID registry is probably the next most efficient way to be able to do that. So once again, work with our team members to make sure that everything's secure and rolled out as effectively as possible.
Now, I'm sorry, did you mention this? Was there a cost to this registry or is it free to join?
That would be something that would be discussed with the opportunity. As far as I know right now, it is free to our Get With The Guidelines partners as of right now. So that's where we're at right now.
Okay, good to know, good to know. And I know, Dr. Corey, you mentioned about the whole interoperability part. I know it's the buzzword in healthcare. I'm on health IT on the back end. And, you know, that continuity of care is so important, and having a cardiovascular champion within each office. That's a tough one. We're not there yet. Slowly but surely, the strides have been made to get that, you know, EHRs, your electronic health record, to read each other. we'll get there hopefully. Maybe I'll be able to tell my grandkids someday, but anyhow, we're not there quite yet, but that's a very important part to that continuity of care for our patients. And let's see, next question. Oh, what do we got here? What lifestyle programs, and this one might be for Ivy, or if any other panelists, feel free to jump in. What lifestyle programs or program would you recommend for the management of hypertension?
Thank you. So we have, there's several lifestyle programs out there in Indiana, but just for the purposes of my job and my team will work on with the CDC program and grant, CDC is recommending very specific evidence-based programs and for hypertension management. And these programs are, of course, they want us to talk to our partners and our physicians to refer patients to the diabetes prevention program, also called DPP program. They're also recommending the YMCA blood pressure self-monitoring program. And they also recommend Weight Watchers. People refer to these more as TOPS, but it's taking pounds off sensibly. And yeah, so other additional programs they've also recommended is the SNAP-Ed. This is the Supplemental Nutrition Assistance Program, and FNAB, and that's the Expanded Food and Nutrition Education Program. And both of these programs, they're free and they're offered by the Purdue University Extension Nutrition Program in Indiana. So those are a couple of programs that we actually recommend our health systems partners to refer patients to, especially for cost purposes and just for it being accessible in Indiana, and of course evidence-based that it really does work to prevent and manage hypertension and high blood cholesterol.
And if you don't mind me adding something quickly, Ivy, the programs that Ivy just mentioned are very helpful for people with hypertension. However, if a patient that already is diagnosed with diabetes type 1 or type 2 also has hypertension, there is the program Diabetes Self-Management Education and Support Program, or DSMES, that the CDC recommends, and that could be useful to them as well. If with that program, they have to be diagnosed with diabetes.
Exactly. Thank you for putting that in.
Patty, I want to also maybe just share, in addition to those opportunities, the American Heart Association is working with our clinics, especially our FQHCs throughout the country, on that SMBP, the self-measured blood pressure monitoring campaign. So working with them to make sure that, once again, I talked earlier about COVID, hospitals, clinics, and even, patients may not necessarily want to go to the clinics for a variety of different reasons. So we're able to kind of really look at patients' blood pressure over, 2 weeks, a month, and beyond. And AHA is really working with these sites to be able to get those blood pressure machines into the hands of individuals. So that's something we're working on, that system, to make sure that they can still continue that monitoring. We're also working with our healthcare professionals to make sure, through that Target BP campaign that I talked about is one of our ambulatory one, making sure that we're providing the guidance and resources for our healthcare professionals to measure accurately and move forward with hypertension management. So hopefully we're doing it on the front end as well as on the back end with our healthcare professionals.
Yeah, and I would like to mention that a couple of our health centers actually partner with AHA, American Heart Association, and American Medical Association to implement the self-monitoring blood pressure, and as well as Target BP. So they're doing really well using those programs.
Great, thank you, everyone. Yeah, more than ever, the virtual care with the pandemic, that self-monitoring blood pressure has become even more important than ever. Let's see here. We have no questions coming in the Q&A, and that was end of my questions for the panelists. So if either of the panelists or presenters, I know Dr. Corey, you had a wealth of information and you could have talked longer. If you want to talk a little bit more, or Phil or Mona, I know there was a lot of great stuff you guys had, and 25 minutes just isn't a lot of time to cover all the great stuff. So if there's anything else you wanted to highlight.
Okay, well, I'll take that opportunity. Never down. So we talked about, when we talk about congestive heart failure, there's two types. You got one where You have a reduced ejection fraction. That's when your EF, or that's how well your heart pumps, is below 40%. And it's now well established. I showed you 2 large clinical trials, one with dapagliflozin, one with empagliflozin. Regardless of your diabetic status, you get benefit from that drug. There's the other huge category of heart failure called heart failure with preserved ejection fraction. That's when you have an ejection fraction above 40%. That type of patient has never, ever been shown the benefit from any drug on the market to today. Never. We have never been able to, we've had all negative studies. Entresto, aldactone, everything you can think of, ACE inhibitors, we've never had a positive study. These 2 drugs, dapagliflozin and empagliflozin, are participating in 2 large-scale trials right now as we speak in that category of heart failure. We should see those studies probably within the next 12 months, and those will be groundbreaking. If those are positive, again, those will be landmark trials because that is a completely unmet need that we've not been able to fill. So keep your eyes open for those 2 trials.
Okay, great. Thank you, Dr. Corey, for sharing that information.
Okay.
At this time, I do not have any of the viewers. You have any questions, please type them in the Q&A. It's your last chance. I did want to mention that we do have email. If you do think of after the fact, always after a presentation, you think, oh, I should ask that question. There are email addresses for each of the presenters, I believe. And I don't think we listed one from Dr. Corey, but Alia's email is there. So if you think of anything after the fact or myself, please reach out to us. We're more than happy to try to answer your question and direct you in the right direction. So this time, everyone, is there any further comments or questions?
So Patty, I actually have something.
Sure.
Before Corey spoke, I apologize. You mentioned about the importance of virtual education due to COVID, and at the Indiana Department of Health in our section, we have recognized the importance of virtual education, whether it be through telehealth or virtual platforms. And I'm really excited to share that through our 1815 grant, we are adopting an online DPP platform, and DPP stands for Diabetes Prevention Program Platform, that we are calling Inspire Health. And this platform is going to be available for health systems or currently recognized CDC national DPP programs to use. And the purpose behind this program is to increase access to for diabetes prevention programs to people at risk for diabetes. And we're really excited to get that set up and going. And I truly believe it's going to help with the rates of diabetes. As we know, the diabetes prevention program, if our participant completes it, can reduce or delay their risk of developing type 2 diabetes by over 50%.
Okay. Kat, could you, the DPP program, Diabetes Prevention Program?
Yes.
Okay. And you mentioned that it's virtual education. Is this where you can log on to the website and watch a tutorial, or how does that work?
Yes. So with this one, there are pre-recorded videos that a participant will watch weekly, but there is still a lifestyle coach. They will just interact with them as if they were talking on Facebook with one another through messages, chat boards. And the really cool thing about this is it's you can access it through your personal computer, but there's also an app on your smartphone device to use as well. And if anyone wants to check it out, we actually have a web page up right now. The platform's not up and going yet to use, but our web page is Inspire Health DPP. So INSPIREHEALTH DPP.com. And there's a short video about what exactly the platform is like, a few testimonials, just goes into depth with it. And I'm really excited about it. And like I said, it's going to be open for all Indiana partners to use if they want. Our goal, if they use it, is to just become a recognized CDC site, which many people already involved in the diabetes prevention world know that having that recognition is huge when it comes with reimbursement credibility. So I'm I'm very excited. I think I've mentioned that like 5 times.
No, it's awesome. Thank you, Kat, for sharing that. Now, we did have a question in the Q&A. When will that become available to everybody? Is there a date?
So we are hoping to fully launch the program for cohorts to start by this July. No guarantees with COVID and everything going on with the work at the state, however. But in the meantime, if you are interested in learning more, talking to us about it, you're more than welcome to contact me, and we can even get you trained beforehand. So when you are ready to start that cohort and it is ready to go live, day one, you can get it going.
Okay, awesome. Thank you. And let's see here. We have more questions. It looks like that was it. And we just answered Amy's question.
Patty, I want to also maybe end it with the way I kind of started. I wanted to thank everybody as well. Dr. Corey said a couple of things that really sparked me. There's going to be a lot of things that we do measure, patient outcomes, diabetes management, but there's going to be a lot of things that we never have the opportunity to measure. Like you mentioned, getting on different committees, getting involved in your community, sharing your voice and being an advocate, whether at the state, local or federal level. Some people donate dollars and support as well. So I want to thank everybody as well, even to like Mona and our partners at Novo Nordisk and other organizations. This is not one path for us to follow. There's a lot of different ways to do this. And I just want to thank everybody for giving the time to listen and learn from us, but more importantly, to help implement and really roll out their portion of it within their hospitals and health systems. So thank you very much, everybody on this panel and everybody on the call as well.
Great. Thanks, Phil. And okay, I know we got 15 minutes left, but if there's nothing else, I don't have any further questions in the Q&A. And I see that in the Q&A section, they've included the links to Inspire. If those of you that are interested, fabulous program coming up, highly recommend checking it out, and spread the news to any of your clients, or not clients, but your providers or other friends in healthcare. So if there's no further questions, we'll go ahead and wrap it up for today. Thank you again for attending. Thank you, presenters. You guys have done a fabulous job. So much information. I've learned a lot myself. And we hope that the viewers also found the information that was presented beneficial to your practices and to your patients, and helping to improve the quality of life for our patients. Some really great programs happening out there. One of our many goals here at CADI is to connect great resources and evidence-based guidance to help improve the lives of our, not only our patients, but our communities. Very important during this time of COVID, and we're all in this together. So I just ask that everyone please stay healthy, stay safe. And if you have any further questions, the agenda has all of our email addresses in there.